Let me introduce myself. I'm Dougal Thompson from The Economist. I'm based here in Geneva, and I'm looking forward to exploring with our panel and with you as well what are the opportunities that exist to bring food fortification to the people who need it most. I think the number one lesson that I've learned from working on food security and nutrition security over the last couple of years is that the only way we are going to accelerate progress on this issue is through partnerships and collaborations. And partnerships and collaborations between groups of people that perhaps in the past haven't been accustomed to collaborating and working together. That's the private sector, governments, NGOs, and civic society. In English, we have an expression, uneasy bedfellows. I think that's probably the best way of describing those groups of people. But they have to work together and collaborate. And I'm convinced that there are ways and mechanisms and partnerships and collaborations that do make sense and which work for everyone, which allow the private sector to do what they want to do, which is ultimately make money and reach customers, but also allow governments to improve the nutrition security of their population and allow NGOs to achieve the goals that they want. I'm starting to learn and read about examples of partnerships that do work, but at the same time, they're incredibly difficult. They're complex beasts, and one thing I hope we can discuss today is not just learning more about this new partnership with DSM and World Vision International, but also getting the benefit of our experts' experience and your experience with the partnerships that you've been involved with. What has worked? What hasn't worked? How do you align the goals and the skills and the capacities of different kinds of actors so that ultimately everybody benefits?
Well, in the past decade, there has been tremendous progress in health outcomes in many of the areas in Tanzania, and particularly the health indicators are very good, with an exception of nutrition. The Tanzanian children and women, the nutritional status is not improving at all. And I would like to give you a few statistics just to give you the magnitude of the problem. We have a 42% of children under 5 who are stunted. We have child underweight of 16%. We have 1/3 of children who are micronutrient deficient, and 59% of these children are anemic. So you can see the magnitude is huge, but it's not only for children, but also women. 1/3 of women aged between 15 to 49 years of age are deficient in iron, vitamin A, and iodine, and 2/5 are anemic. And it is for this reason that we think it is now time to prioritize nutrition interventions in Tanzania. A lot of areas have been prioritized in health, but nutrition lagged behind. And I think now is the time when the world has decided to prioritize nutrition, and the countries are following that example, and we are having a lot of strategies in country so that we can now make sure that the nutritional status in our countries is improved.
Okay, great.
Everything in place. We have a policy which needs to be amended. It's an old one, but I think amendments so that it can align with the current development is in place. We have a strategic plan, a national multi-sectoral strategic plan. We have an implementation plan, and we even have a steering committee. And not only at the national level, but we have gone even further down. We have focal points at subnational level, regions and districts. So I think the policy and strategies are in place. All we need to do now is to get all stakeholders on board so that we can implement the interventions.
Okay, great. So we've heard about nutrition from a Tanzanian perspective, but where does nutrition sit in terms of Dutch policy? How do you think about this? What are your plans and priorities, Paulus?
We all want to have a world which is probably better equipped to deal with tomorrow in here, and we need to start today in, let's say, hand in glove partnerships here who are going to resolve them. We have a new policy in my country, and we have a Minister of Trade, International Trade and Development Cooperation that illustrates the approach the Dutch government has in relation to trade, aid and investment. That's the area they work on. At the end of the day, the goal of development cooperation is to make people self-reliant, to help people helping themselves. At the end of the day, it's this way that we are only temporary there to help people. By the end of the day, it's also the role of business to take this and conduct it in a sustainable way. So yes, it is important. So how do you practice that? We believe firmly what we call the golden quadrant, or maybe I should say the diamond in which you want to operate. And this is the collection between government, private sector, civil society and knowledge institutes working hand in glove to make that work. And that has a history. I mean, my country is we say a polderland. You don't know this, but people talk towards a consensus. That's the way we always used to do so. And moreover, we need to talk to other people because our country is a very small country and outside is a big world here, so you need to interact with people externally here. But we believe firmly that if you bring together the collective skills of those four parts of this, let's say, diamond, there is where solutions will come. Because the issues are big enough, are so big that there is not a single player who is going to fix it. We facilitate that. So with our embassy in Tanzania, with other embassies in our partner countries, we work closely to see where and how can we help. The solutions are not in The Hague. The solutions are in the country themselves. Where the government is responsible is going to happen. But we can help with expertise, with funding, by bringing people together to be a platform here to make these type of collaborations eventually deliver on getting more people to better nutrition. Yeah. And as far as we are concerned, you need to start early.
We're not all Dutch in the world, and we don't all function by consensus. And particularly in the private sector, it's not always like that. What lessons have you learned about getting the private sector collaborating and making sure that they see the benefit of the collaboration? And
it's not only public-private, it's also private-private. We have already, we've signed a big agreement on a big partnership which involves 10 different private companies working together. Why is this? Because there is a lot of pre-competitive knowledge you need to be able to share in order to, let's say, see the hurdles and overcome those hurdles and to deliver together. You can only do that if you're open. So transparency in this is key. Let me tell you, maybe there are 3 aspects which are important. First of all, you need to know your stakeholder. You need to know maybe your stakeholders as well here. To whom am I talking here? If you don't understand business, don't work with business. If you don't understand government, what's the point in working with government? So try to learn from each other as to what is in there as an advantage to work together. That's one. This takes time. I must say, my former colleague Marty Verlier is sitting over there. We worked on partnerships, and I can tell you, it's a heck of a job to get things done. But if it works, you will benefit. Secondly is you need to build a good plan. You need to have a solid plan here to work from. You don't have to, let's say, at least the destination of your journey should be clear. One plan. There may be individual goals, but there is a common objective you need to achieve. Third point is have the resources in place. That's very important. And across that, it is no surprises in which you work. That is what we call a partnership approach here, where this, sometimes we call it the golden diamond, but the diamond approach, those 4 stakeholders are present.
Thank you, Paulus. Francesco, can I bring you in for a WHO perspective on this? What are you doing, what are you working on at the moment in terms of a global plan for nutrition? And how do you try and translate a global plan into success at a local level?
You know, we have to acknowledge the fact that although there's been some progress in, for example, stunting reduction, there's been certainly progress in reduction of wasting, but we still have enormous challenges. I mean, we're seeing, for example, that the breastfeeding rates are actually globally going down, maybe because there's more women entering the workforce without the necessary guarantees. And then we have the epidemic of non-communicable diseases. We have incredibly fast development of overweight since really early childhood. So there are challenges, but at least we recognize these challenges. So since then, I think there's been really a series of interesting development in terms of how different actors have been active in responding to these challenges, and how not only there's been a global movement that is addressing those challenges, but also there are a lot of country initiatives. We have been very active as UN, and not just WHO, but also the other UN agencies as actors of the scaling up nutrition movement. But we are just actors. I think the leadership is really in the hands of the government. I like the concept of partnership, but I also should say that there is a major challenge in implementing partnerships, because you don't necessarily have full policy alignment between the different actors. I mean, as you said at the beginning, certainly the private sector has the responsibility towards its stakeholders, and there could be a discrepancy between the interests of those stakeholders and general public health interests. So I think we are seeing, it's a very interesting development what's happening. We are hopeful that things will happen, but we are facing great challenges. The policy alignment, I think, is the first one.
I want to ask you, and invite us all to think about, is the people who have been involved in partnerships, is what do you know about partnerships now that you wish you'd known 5, 10 years ago? Or what are the key lessons that you've learned? And we've heard, articulated already by Paulus and the Minister, but how would you articulate that?
There are some actions that require the involvement of different sectors in society. I mean, I think we've heard about the fortification of staple food. That's, of course, quite important, because we have processors and producers, and they have to be the ones who implement the right policies and also work through the channels to have these items distributed. So that, of course, is a good example there. We have other examples where I think the engagement with the private sector becomes a bit more difficult. And in a sense, this is really the hot area we're discussing today, which is child nutrition. How can we make sure that we provide the right food, and these right foods are presented in the right way? So how can we ensure that we don't have, for example, a promotion of food, of baby foods, which is counterproductive, because we want to have children exclusively breastfed up to 6 months, and then we want to transition children from breastfeeding of the mother to a family diet. But we have a gap there, and we know that actually there is often poor quality complementary feeding. There's a poor quality nutrient. There's a nutrient gap there. So how do we address that? And then there is a potential solution through the production of foods, but then it's a risky one, because if we have then an excessive commercial pressure there, we basically replace the role of mothers, family with something which is actually not necessarily in the interest of the livelihood of the family and in the health of the children.
Stefan, I'd like to bring you in here. So let's have our first private sector voice and contribution on this. What do you see as the private sector's role in general in tackling malnutrition? And also, from your own personal experience, what have you found to be the benefits of working in partnerships with governments and NGOs? What have been the challenges of working with them? I don't want you to think that just because you're sitting next to the minister, you can't be rude about policymakers. Okay, you can be as forthcoming as you like.
Maybe let's step back for a moment and reflect on the fact that all food is local. In the end, most of you have eaten today, and I bet that 99% of that food came from the private sector. That food was, if it was originated in a field, most likely it was planted somewhere by a farmer, it was harvested, it was transported, it was processed in some way, and then until you ate it. That, for the most part, is done by the private sector. Now, the private sector cannot operate in isolation, of course. It needs to operate in a context of policy and framework and regulations. But we take for granted in this country and this region that our flour is fortified with folate so that we don't have spinal tube defects for our babies. That's not the case everywhere. We take for granted there's vitamin A in our milk. That's not the case everywhere. So what we're talking about here is really working on a country-by-country level of developing the food industry, allowing farmers to be more productive, allowing their crops to make the market, working with grain processors, and that's something we're going to focus on, working with grain processors, how to make quality products and comply with the policy that the government has instituted. And for that, you need to work together already with the government to understand the policies, how to implement the policies, with civil society. And then there's, of course, a huge knowledge gap. All the work that we do, talking to consumers, although that's a very Western term, mothers say, okay, what do you know about nutrition? For example, we did some research recently in India, and it is very, very basic. It's basically, do I have enough energy to get through the day? Yeah? So, well, who can educate those mothers? Well, that should not be the private sector, to be honest. That should be government. Huh? It should be government, that should be civil society to educate, and say, okay, these are how things work together. So I think to build an infrastructure, to build the knowledge, build capability, it's only possible if you have the 3 or 4 corners of the diamond that Paulus described work together. And that is not the case everywhere. And in those areas where stunting is as prevalent as we've heard here, there's improvement needed. And we have the knowledge, and it's I think unconscionable to just sit on that knowledge and not do anything about it.
That's the real issue here, is how do you extend a project on such a scale that it touches millions? What are the issues and challenges that you encounter when you try to scale things up to a level where they really do make a difference?
First, you cannot answer that on a global basis. You can answer that on a country-by-country or region-by-region basis. Huh? And the answer is slightly different based on that context. Is there already animal protein in the diet? Are there vegetables in the diet? What are the cultural norms? You know? And then say, okay, how can we create a solution for that context working together? And that will be different. Is it in Andhra Pradesh, or is it in Tanzania, or is it in a province of Ethiopia? But what's common is that you need to do it locally. I say again, signing these documents in Geneva does not get it done. It's working with people locally to understand the context and then design a solution locally.
Kevin, your perspective, and we're really talking about partnerships today, what are the opportunities you see for partnerships to really make a meaningful difference on maternal and child nutrition?
I think the first rule of partnerships is don't do one if you can have the same impact on your own. Partnerships are complicated, they take a lot of time, need alignment of interests, so on and so forth. So we don't go roaming the world looking for partnerships at all. But there are times, and in World Vision, one of the things that we're saying is we want to move beyond anecdotes, beyond the story of the child, the story of anecdotes. Stories are important, stories are a part of our DNA, but we want to move toward evidence and scale. So our vision within World Vision is to contribute to the well-being of 150 million of the world's most vulnerable children by 2016. So we are trying to go fast and take what we're learning in the community. We've probably got more staff and volunteers and activity in the poorest communities of the world than almost any other organization, certainly any other NGO. And take that learning and scale it up at a country level, contribute to the global discussion, and so on. So you do a partnership when your core competencies combined with the core competencies of others can connect to make the possibilities completely different than what you could have done on your own. And so our core competency as a NGO and the sort of NGO we are, I would say our core competency is the last mile. DSM's a science company. They're experts at fortifying and nutrition and a number of areas. But often we find that people can get their expertise into a country or into a region in a country, but they don't know the community at all. They don't know how the community works. They don't know who the leaders are. They don't know how to sustainably integrate, who to work with, and so on. We do. Our staff live in those communities. And so you combine that with the involvement of the government, because in the end, the health of the people in a country is the government's responsibility, not an NGO's responsibility, and we want to leave. That's sustainable. It's sustainable when the health system covers everybody. So anyway, in understanding everybody's core competencies, and I totally agree with, been said by a couple of people here, individuals from these different sectors, they may all speak English, but they speak a different language. And so to really try to understand each other and to make yourself understood, you're not going to get identical. Don't even try. If you want to be identical, don't partner. But you can be aligned in interest around something like nutrition. So
the other question I wanted to invite you to think about was what you want to see happening on a global level and how nutrition is taken seriously. And specifically, do you have hopes for 2015, the next iteration of the Millennium Goals? Where do you want nutrition to figure in this?
Like many in this room, I have invested a fair amount of hours of my life already, and 2015 is 2 years away, on this framework for post-2015. And the United Nations is getting so much input on what must be included. And from our perspective, and I touched on this in my remarks, nutrition should have a high profile, nutrition security, because it is a building block off which everything else builds. If a child is not healthy, and it's not just health, because if you're healthy, you spend more time in school, you're learning better, you're able to concentrate. And there's now a number of studies around how nutrition, which leads to health and so on, actually is a multiplier for the economic possibilities of the country. So it just makes sense as a core platform to have nutrition as a beacon in this framework. And as Stefan has said, we haven't understood this first 1,000 days of important nutrition for that long. It wasn't really properly understood in 2000 when the initial framework was put in place. And so it deserves to edge in the next round.
Yeah. Minister Mwinyi, do you find that nutrition is now taken more seriously at government levels? When you meet your fellow ministers, do they get the importance of nutrition more than they used to?
Nutrition now is very high in all agendas. When we come to these global meetings, nutrition is up there. When we talk at country level, nutrition is there. And because I think of the multi-sectoral nature of nutrition. So now it's not about health only, it's about agriculture, it's about investment. So Minister of Finance now agreeing that it's important to invest in nutrition. So it is something that has, has been prioritized. So, and we believe that with this momentum, we could do much better in the coming years.
How easy or how difficult is it to get the people with the cash to invest in nutrition projects where the payback, may not be for many years?
I think it's going to be okay because now we have this multi-sectoral strategy. Nutrition is there in most of these ministries' strategies, so they must be funded, and because we need that strategy to be funded. In the past, we didn't have that. So I believe now that since we have put it in all these stakeholder strategies, it will be funded.
Carol, let me bring you in, please. You work at the partnership. That's what we're really talking about today. Could you start by just explaining a little bit what your partnership is, and then can I invite you to think more in general about what we've spoken about already, the do's and don'ts of partnerships, the lessons that you've learned, because I know that you've worked for a number of different kinds of stakeholders in the past. What have you learned about partnerships and where they can really be effective?
Okay, well, the Partnership for Maternal, Newborn and Child Health is a child officially, it's 8 years old. It was set up to amalgamate some different partnerships, realising that actually you have to focus on the population, not a single issue or a single part of the continuum. So it came together from different constituencies. It now has 7, so in fact it's a diamond septagon, I guess, or sometimes rusting, depending, we'll get onto that. And we have the private sector most recently in the partnership. Honourable Minister is on our board, World Vision is on our board. We have the NGOs, we have the donors and foundations, we have the healthcare professionals, all the key actors in various combinations who can do something. I think, Kevin, you said, don't do it, don't go about doing it together if you can do it alone. And we're very clear about that. And when we get on to what works, I think it's having that focus. You have to really decide what it is you can do together. We've managed to bring together, sometimes we don't always reach consensus, but we get as far as we can, on some really important issues. So actually when people say, what do you do for a living? I sometimes say, depending on the audience, it's kind of a speed dating service, and the bedfellows don't always get on, but we're trying to resolve that issue. So a couple of very tangible examples. We brought together people around the essential interventions for women's and children's health. There had not been really international agreement, and so 50,000 studies, and I'm not exaggerating, were reviewed. My only contribution was to lock this bunch of academics and others in a room for 3 days without much food and water, abusing their basic human rights, until they came out with an agreement on what was really needed. And now that's really being rolled out. Actually, we've heard recently the government of China is interested in translating this, government of India is picking it up, and it's a dynamic document. And again, we will be constantly reviewing it to see if it's still relevant, and how we use the partnerships to do what other people said. How do we scale up? How do we really keep moving? We come together to do various campaigns, particularly picking up on very neglected issues. There was stillbirths, was very much an unknown issue. If you added the stillbirth figure to child mortality, if it were counted, it would account for about 1/4 of all child mortality. And obviously it's a very significant issue around nutrition of the mother. There's many factors, some of which we don't know about. Campaign this year around the newborn, and obviously then what happens to that newborn after it's born, the importance of breastfeeding and continuing. So we bring these people together, we try and work out what is the right configuration. I see somebody in the room from the Interparliamentary Union. We were talking earlier about policy change, how does it happen? Well, I think if parliamentarians around the world can agree that this is a top priority, can commit to getting this into their budgets, can commit to the accountability, and Tanzania has been a real leader on accountability through President Kikwete and his interest in women's and children's health. So yes, it's bringing the partners together, but it's not always easy. I think what I said about keeping the focus, agreeing on the vision, deciding how you're going to get there, because it's very easy for people to use partnerships for their own specific interests. So you need at least your board and the wider group of partners to agree, well, what are the 3 or 4 things where you can really move the needle, and don't allow people to come along and sort of say, well, wouldn't it be a good idea if, from some particular interest group. So keep your eye on what it is you're doing. As somebody also said earlier, there's a profit motive, but there's also, I think, a real sense that people want to do the right thing. So using the corporate values to move forward.
Following up on that, Stefan, to what extent, maybe Kevin's got a view on this as well, do you sense that shareholders and customers are now increasingly putting pressure on the private sector to be demonstrating that they are doing good out there? I mean, is that a phenomenon that is on the increase? Is it sizable enough to really influence companies?
Well, actually, I think we're way beyond that. And the governance of companies is a little bit different in different parts of the world. I've worked for a US public company, private company now, for a Dutch public company. I have to say, our Dutch heritage here is very much a stakeholder model, where we, my CEO, I'm as a board member, proudly say I don't work for shareholders only. You know? We work for stakeholders. And when you see that, when you look at our annual report, you will see the business part is about that much, and what we do with other stakeholders has, whether it's the environment and what we call Eco Plus, or how we influence people's lives, what we call People Plus, have significant parts. In fact, to get really personal, half of my incentive compensation is pegged to sustainability related and People Plus related activities. So I would say there the Dutch governance is very much blazing a trail of what is the role of companies in society, which is quite different than in, let's be honest, in the Anglo-Saxon context, where it's make the shareholder rich and then the shareholder can decide what to do with the money, and they do often very good things. Look at Gates, look at Buffett, but it's a different model. So for us, we don't look at this as CSR. For us, this is part of the regular business. This is what we do as a company. Now, let me also be clear. This is not big business for us, but we have the expertise. We have the expertise. We have the knowledge. We have the science base. And as we found, it would be a shame to waste all of this expertise on making dietary supplements for the United States consumer. That would be a waste of that know-how. It is the same know-how can be very well used by World Vision on how to work on interventions where people need them. That doesn't generate a lot of business for us, but it leverages that know-how. It leverages that know-how, and yeah, that's part of who we are as a company. So it's not because the shareholders pressure us, for sure not.
Okay, Kevin, what do you pick up from the non-Dutch Fortune 500 companies?
Yeah, I think Stefan has basically alluded to it, which is if you make a generalized statement about how the corporate world approaches these sort of issues, you will be wrong, because different companies come at it very different ways, and what Stefan just described there is inconceivable for the typical Western or Anglo-Saxon public company. One thing that he didn't say that he's said to me in the past, in addition to what he mentioned, is to attract and retain the best staff, you have to, and I'm talking about DSM now, you have to show that you're prepared to live your values, not just put them in your annual report. So there's many facets to this, and that's why you have to pick your partners carefully.
You've delivered a fantastic conversation today, and you've all played your part. I hope you've benefited from it. Good luck with all of the partnerships and collaborations that you do. Good luck in Tanzania. Good luck with the partnership. And please give our experts a round of applause.